Good afternoon. My name is Robert Taylor, and today I will be talking to you about HIV/AIDS. AIDS, which stands for Acquired Immunodeficiency Syndrome, is a disease in which the body's immune system breaks down, and it becomes vulnerable to infections, minor illnesses such as the common cold, as well as harmful bacteria. And even that can be deadly. The topic is very sensitive to me because there are many individuals in my family and family friends that I know of who are living with the disease. So I wanted to present to you some facts about the disease and let you know how it affects the everyday life. According to the Joint United Nations Program on HIV/AIDS, it is estimated that there are about 33 million people living with HIV/AIDS worldwide. And it's sad to say that most of them don't even know that they're living with the disease. So at this point, I bet you're wondering, well, how is HIV/AIDS contracted? How does it enter the body, and what can it do to me if I contract it? Well, according to inform.org, any individual with HIV/AIDS carries the disease in certain body fluids such as blood, semen, vaginal secretions, and breast milk. At any point these fluids enters the bloodstream, you contract HIV or AIDS. Ultimately, there are four main ways that HIV/AIDS can be received, and these are the following. First, we have unprotected sexual intercourse, and this can be with both male and female, with someone who has HIV. Next, you have sharing needles for those of individuals who like to get tattoos, sharing needles or syringes with someone who has HIV or is HIV infected. Laboratory studies show that infectious HIV can survive and use syringes for about a month or so. Next, we have infection during pregnancy, childbirth, and breastfeeding. And this is mainly because HIV and AIDS is mainly acquired through the receiver in sexual intercourse. So more than likely, it'll be the mother or her child that she's bearing who contracts it. And lastly, we have unprotected oral sex, and this can be both vaginal and penile. So at this point, you're probably wondering, well, I know that I can get it from having unprotected sex or sharing needles, but what if I kiss someone, or is it airborne, contagious through the air? It is not true that HIV/AIDS can be transmitted through kissing, coughing, sneezing, or sharing food. As mentioned earlier, it's when those bodily fluids enter the bloodstream that HIV or AIDS is contracted. And although there are no symptoms of the disease, contracting this disease is 100% preventable. For starters, an individual can practice safe sex, using condoms for both male and female. In the use of needles, make sure that the proper precautionary measures are taken to ensure safe and clean usage. To gain more insight about HIV/AIDS, you can feel free to log on inform.org, or you can contact the Center for Disease and Control information line at 1-800-458-5231. Thank you.